Hi, this is YouTube Medical University. Today's video covers Hashimoto's disease. You've probably heard of it at least once, but don't really understand it. The thyroid gland seems important, but you may know it's an organ that makes hormones but lack the details. Maybe that's how you feel watching this video. Physical discomfort, feeling mentally down, or recently becoming more forgetful. These problems might actually be caused by Hashimoto's disease or your thyroid gland. If you leave it untreated, one day it could suddenly become life-threatening. That's how scary thyroid issues can be. You might think I'm exaggerating, but this is actually true. Today, I'm going to talk about something that's important. The other day, a woman in her 60s, Miss A, came to my clinic. She was a very lovely lady and her daughter accompanied her. Miss A told me that she had recently started forgetting things much more often and she was worried that she might have dementia. She spoke with a very anxious expression. She said, "Doctor, it feels like there's a fog in my head and I just space out. I can't remember people's names. I make mistakes in cooking steps and I'm sleepy all day. Is it just because I'm getting older?" That's what she told me. Miss A also had some swelling starting to appear. Several symptoms occur when thyroid function decreases. They matched. Suspecting this, I checked her thyroid and diagnosed Ms. A with Hashimoto's disease, which explained her symptoms. After prescribing thyroid hormone medication and starting treatment, about 3 months passed and Ms. A looked like a completely different person with a very lively expression on her own. Now she comes into the exam room alone and told me, "Doctor, thank you. The fog in my mind is gone and the fatigue has vanished. I'm enjoying gardening again." Just like Mrs. A, some people experience unexplained pain. Many people feel discomfort, blame age or themselves, and end up giving up. I'm making this video for those affected. Hashimoto's disease quietly and steadily changes the body. So about this disease, I will explain it in an easy to understand way from the perspective of an active doctor. By the time you finish watching this video, your vague anxieties will be gone and you'll learn when to be cautious about symptoms and if they apply to you. This video helps you understand these points. Watch until the end. So here is today's agenda. First, in the first section, we'll talk about Hashimoto's disease and hypothyroidism. I'll clearly explain what those terms mean. They're simple. Next, in the second section you've been waiting for. This is likely the part you're most interested in. With Hashimoto's disease, unexpected symptoms may arise, sometimes mistaken for depression or dementia, and in some cases can cause life-threatening complications. At the very end, I'll also introduce signs that could be life-threatening, so please make sure to listen until the end. First, I'll explain the true nature of Hashimoto's disease, the source of many health problems. Why did Mr. A develop such a variety of symptoms? The root cause of those symptoms is... I'll briefly explain the thyroid gland. It's butterfly-shaped and located at the base of your neck, near the Adam's apple. It's a small, thin organ. From here, it secretes a hormone called thyroid hormone. This thyroid hormone is like the accelerator pedal in a car. On health programs, it's sometimes called the energy hormone. In other words, it handles the body's metabolism. It's responsible for the metabolism that allows us to live energetically like this. The thyroid hormone is responsible for the accelerator part. In other words, it gets the body's engine running, raising body temperature, keeping the heart working energetically, in other words, affecting heart rate, and promoting the metabolism of all the cells in the body. It helps burn energy and keeps the body active. That's the role of this hormone. So, what happens when that system breaks down? What kind of disease is Hashimoto's disease? It's named after Dr. Hashimoto, who discovered it. To put it simply, your own immune system mistakenly attacks your thyroid. Normally, your immune system protects your body from germs, but in this case, it mistakenly attacks and destroys the thyroid. That's the true nature of Hashimoto's disease. The immune system, which usually acts as an important bodyguard to protect you, in Hashimoto's disease, the immune system mistakenly thinks your own thyroid is a foreign object or an enemy and attacks it. As a result of being continuously attacked, the thyroid slowly weakens and declines. The thyroid, which produces the vital hormone that keeps you energetic, can no longer secrete this hormone. As a result, since your body doesn't get this energetic hormone that acts like an accelerator, your body temperature may drop, your brain activity may decrease, making it hard to organize your thoughts. You may lose motivation, and your metabolism slows down, causing swelling throughout your body and various other symptoms. Actually, Hashimoto's disease is especially common among Japanese people, particularly women. It's said that about 1 in 10 women has Hashimoto's disease, so it's not something that only happens to others. There's a high chance that either you or someone among your relatives or friends has it. It's also said to be most common among people in their 30s and 40s, so if you're in that age group, please be especially careful. Genetic factors, stress, childbirth, and even catching a cold, these kinds of things can all... It's said that Hashimoto's disease can easily develop at these times, so if you've lost your energy due to any of these triggers, I think it's worth getting tested. I'll explain about the test at the end of the video, so please listen until the end if you're interested. When Hashimoto's disease causes the thyroid to deteriorate and not produce enough thyroid hormone, the condition where the thyroid's function is reduced is called hypothyroidism. In other words, Hashimoto's disease is a condition where the immune system mistakenly attacks your own thyroid. As a result, hypothyroidism develops. Knowing the reason makes it easier to understand, right? Up to this point, it's totally fine to just have a rough idea that something like this is happening inside your body. Next, I'll explain what signs show up in your body when you're in an out-of-gas state. These symptoms are often misread as other illnesses or aging, but shouldn't be ignored. I'll share 6 symptoms, so listen until the end. You'll regret missing them. Here are 6 signs of Hashimoto's disease. The first one is simply feeling extremely sluggish. Some people say, "Doctor, I've been sleeping about 8 hours lately, but no matter how much I sleep, I can't shake off the fatigue, and getting up in the morning feels like hell." Some people describe symptoms like this. You might think it's just a matter of willpower or that you're being lazy and need to push yourself harder, but if your thyroid is the cause, it's clear that your body is currently in an out-of-gas state. It's like you can't hit the accelerator. The thyroid controls energy metabolism in every cell, so when cell metabolism drops, you lose energy. Reduced brain metabolism leads to weaker brain function. Declining thyroid function causes severe fatigue. Not knowing this could lead to regret. The second sign of Hashimoto's disease is weight gain and something called myxedema. Weight gain and myxedema might sound strange, but what does it mean? In short, it means that water accumulates in your body. Recently, despite eating less and lacking appetite, your weight increases and you feel bloated. In such cases, we suspect thyroid issues. When thyroid function drops, it's like losing your body's accelerator. Your metabolism slows down like a car in ultra fuel saving mode. Since you're not revving the accelerator, it's like a fuel efficient car that can't go fast. Even if you eat, your body is so efficient it doesn't burn energy and just stores it, making weight gain and swelling more likely. The other day, Ms. B, a woman in her 40s, visited the clinic and told me, "Doctor, even though I eat the same amount lately, I've gained 5 kilograms in just 1 year. No matter what kind of diet I tried, nothing worked. I've been very disciplined and put in a lot of effort." Despite everything, Ms. B still gained 5 kilograms, even someone like her. Tests showed it was Hashimoto's disease, and proper treatment restored her weight. So it's not just about overeating. Some blame themselves, assuming age slowed their metabolism, but an underlying illness could be the cause. So if you feel like something is off, please consider visiting your regular hospital, a nearby internal medicine clinic, or if it's related to the thyroid, a thyroid or endocrinology department. Here is the third sign of Hashimoto's disease that you might regret not knowing: being unusually sensitive to cold or having dry skin. Those who know the reasons might guess this easily. When the energy hormone stops being produced, your body can't increase its temperature, causing it to drop and making you more sensitive to cold. Even when everyone around you seems hot, you feel cold. This is a common symptom for people with decreased thyroid function. Also, because cellular metabolism slows down, it becomes harder to sweat, and the secretion of sebum, the skin's natural oil, decreases. This causes your skin to dry out and become rough. If your skin feels dry and rough all year round, even in summer, that's another sign. These symptoms might be related to your thyroid. The fourth sign of Hashimoto's disease that you might regret not knowing is sudden hair loss or changes in hair texture. This is similar to what happens with your skin. Your skin, nails, and hair all have a high rate of turnover. No matter how much you cut them, they keep growing, right? These body parts respond to health changes. I discussed this in a prior video on zinc deficiency, but zinc also impacts your DNA. Since it's involved in metabolism, changes can appear in your nails and hair, but actually these kinds of changes can also happen with your thyroid. This is a serious concern for women, as seeing a lot of hair fall out while shampooing causes anxiety. Your hair is becoming thinner and finer. Such changes may be due to a decrease in cellular metabolism, which can alter hair quality and make hair more likely to fall out. So please be aware of this. If you don't know, you'll regret it. Here's the fifth sign of Hashimoto's disease that you should know: a lack of motivation so severe it can be mistaken for depression. This actually happened recently. A patient was referred to my clinic with a letter from a psychiatrist. The psychiatrist suspected depression and examined the patient, but after talking and doing a blood test, a thyroid disorder was suspected. The letter asked me to please handle the treatment. This is something psychiatrists often encounter. Patients come in thinking they have depression, but when they are examined, it turns out to be a thyroid problem. Activities that were once fun no longer feel enjoyable. No matter what you try, you can't get motivated. You want to have fun, but your mind just doesn't cooperate. These symptoms can easily be mistaken for depression, and I've encountered similar cases. A woman in her 30s saw a psychiatrist for depression for over a year with little improvement. Later, she learned her thyroid was low, which can also cause such symptoms. Even medical professionals can sometimes miss it because it can be hard to tell whether it's depression or low thyroid function. However, if the thyroid is the problem, treating it with thyroid hormones often improves the symptoms. There are cases where people say, "Doctor, it's like a miracle. I got my energy back and was able to return to work." So when you feel like it might be a mental issue or your mental energy is depleted, it's not always just that. It may not be a psychiatric disorder, but an internal medicine issue, so keep that in mind. I've made videos about depression before with some surprising symptoms, so check them out after this. 6 signs of Hashimoto's disease you should know. The 6th is memory loss that can resemble dementia, similar to what I mentioned about depression. Like Mr. A, you might ask, do I have dementia? Some people come to the clinic looking sad, unable to remember names or organize their work tasks. You might feel like your head is in a fog. This is sometimes called brain fog. These kinds of symptoms are also characteristic of hypothyroidism. This doesn't mean your abilities have declined. It's just that your body can't maintain normal metabolism, so your brain is also running in a low power mode. That's all it is, unfortunately. There isn't really a remarkable cure for Alzheimer's type dementia, and people who develop this condition will gradually experience a decline in cognitive function. However, it's a different story if symptoms similar to dementia are caused by the thyroid. With proper treatment, that temporary decline in cognitive function can improve, so it's too soon to give up and think it's hopeless. Before you give up, it's very important to visit a nearby hospital and thoroughly check for physical illnesses before assuming it's dementia. I've posted videos about dementia in the past, and as treatable types of dementia, I've introduced various causes besides the thyroid, such as vitamin D deficiency and subdural hematoma. Please check the description box if you're interested. What do you think? I've introduced 6 symptoms, but there are many others I couldn't cover. For example, your voice may become hoarse or your voice may get lower. Some people experience these symptoms, including constipation. A slower metabolism can cause stool to accumulate, and some discover thyroid issues only after seeing a doctor for constipation. It's difficult to self-diagnose, so if you're concerned, consult a hospital. If you have related symptoms, share them in the comments to help others. As mentioned earlier, Hashimoto's disease can have serious, even life-threatening complications. Lastly, let me introduce just that. It's a condition called myxedema coma. It sounds complicated, and the name is full of difficult kanji, but to put it simply, it's a state where your life is on the verge of going out, meaning you may even forget to breathe or your level of consciousness drops. Your body temperature drops quickly, like it's running out of battery. That condition is called myxedema coma. It's said that about 30% of people who fall into this state lose their lives, so it's a very dangerous condition. The people who are most likely to develop this are those who leave hypothyroidism untreated for a long time, letting it get worse and worse until they end up in this state. Or it can happen to people who were receiving treatment but suddenly stopped on their own, or when cognitive function declines and they can't take their medication anymore. It can also happen in those situations. From this, I think you can understand how important it is to detect and treat hypothyroidism or Hashimoto's disease as early as possible. And that's why treatment to supplement thyroid hormones is extremely important, so please never stop it on your own. Doing so greatly increases the risk of the dangerous complications I just talked about. I know this was a bit of a scary story, but if you feel scared, if you felt that way, I think you'll be okay. I'll discuss a condition said to affect 1 in 10 women. I've introduced some unexpected symptoms of Hashimoto's disease and hypothyroidism. If you thought, wait, maybe that's me, please consider consulting your regular doctor or a nearby thyroid and endocrine clinic about it. Specifically, they'll check your thyroid function with a blood test and use ultrasound to look at the size, thickness, and blood flow of your thyroid. With these tests, most cases can be identified. It will become clear whether you have Hashimoto's disease or not. And the good news is, Hashimoto's disease can be properly treated with medication. Hormone supplements can restore your original condition. It's an illness treated by supplementing the missing thyroid hormone with medication, and it's vital to keep up the treatment. On the other hand, this is a treatment lifeline, so carefully adjust the dosage. Remember to adjust your dosage or get regular thyroid checkups. The serious complications I mentioned often result from stopping your medication, which is very risky. Don't stop taking it on your own. How was that? Thank you for watching until the end. Since I introduced a lot of different symptoms, it might be a bit hard to remember them all, so please feel free to listen to this a few times or take notes. Also, if there was something you learned or something you want to remember, even just a word is fine, so please leave it in the comments. I think it will help you remember it better. Here at YouTube Medical University, we share very important medical information that you can use to become healthier starting tomorrow, and that you might miss out on if you don't know, all explained clearly from the perspective of a practicing doctor. It would really encourage me if you could subscribe to the channel before you forget which channel the new videos are on. If you rate this video, whether thumbs up or down, it helps me improve. I look forward to seeing you next time. Thanks for watching until the end. As a general practitioner, my patients have taught me how to live agelessly from your 70s on. I also aspire to this lifestyle, learning unexpected ways of living from their stories. I've learned from my elders that socializing is more important than exercise and that less medicine can be better for health and happiness at any age. These pages contain valuable wisdom. Check the description below.